I got 4 o'clock, but I'm going to give it just one more minute to 4:01 because I see people still joining us.
Hey, Lindsay, have we tested your mics out yet?
Nope, but now's a good time. Can you hear me?
I can hear you perfectly. Thank you.
Great, thank you.
Right on time. So let's go ahead and get started. I've got 4:01 and I want to be respectful of everybody's time. So if we could move on forward. This is our second EVV town hall for December related to case management. My name is Brian Dowd. I'm the Deputy Executive Director over Policy, Operations, and Compliance at the Department of Community Health. And I want to thank each and every one of you guys for joining us today and continuing to join us throughout the EVV process. I've said this at the beginning and the end of a lot of town halls and presentations, but it is crucial that we continue to get you all's involvement in the federal mandate because you are the ones who are pointing out areas where we can enhance and improve the system so that it works as best as possible while meeting the mandate that we are required to do. So I do want to, just at the beginning, rather than at the end where I usually do it, thank everyone for joining us today. So let me give you the mission of the Department of Community Health, which is to provide Georgians with access to affordable quality health care through effective planning, purchasing, and oversight. So what are we going to talk about today? Luckily, you don't have to listen to me today. Yay! You're probably sick of listening to me, and I am sick of talking at EVV town halls because we are now on month 13 of monthly town halls. So I know it is really, really nice that we're going to have Lindsay do most of the talking today just to get a different voice, and she is certainly the expert in this as opposed to me. We're going to go over some case management function. We're going to do a demo of the case management function, and we're going to do some questions and answers. So we're going to get started with the case management functions, and I do want to let folks know if there are others that are on the town hall, like with all town halls, you are welcome to join. And of course, we will record this town hall just like we recorded all the town halls going back to November and put the presentation on. The earlier December town hall is already on our website. I know because I pointed somebody to it a couple of days ago, but we will record this one as well. So, you know, some people like to go in and look at both of the town halls for different months, but this is going to focus on case management. It's not talking about traditional providers or self-direction. So we are not going to be going over the provider functions or the provider questions today. If you are a traditional provider of CLS or PSS services, you are welcome to use the resources that we have been providing from the beginning as far as the EVV mailbox or the call center resources. And you are, of course, welcome to stay on and hear about case management. But today we are going to be focusing on case management. Next slide. So I do want to let folks know that case management functionality is live. It does view-only access to data for Medicaid members, including schedules, visits, prior authorizations, and it also allows access to reporting. We are kind of unique in the states. I've spoken to a lot of states, just spoke to Montana 2 days ago because we all are kind of talking about EVV and what we do. And I think we're the only one that has this kind of enhanced functionality. And one of the really good points is that it does allow the ability to send and receive messengers to and from aides and caregiving using the NetSmart Mobile Caregiver Plus application. Go on to the next slide. So I'm going to turn it over to Lindsay. Do I turn it over to you at this point? I'm sorry, I've forgotten since our last one.
No, that's okay. Yeah, you actually stole my last line. You're doing great.
Oh, did I?
I'd like to go.
Nice. All right. So I'm turning it over to Lindsay Mack now. Everybody, she is the expert in this area. Thank you, Lindsay.
Sure. Thanks, Brian. And thanks everybody for joining. If you joined the last one, this will be the exact same information is going to be covered again. So if you want to hear it again, you're more than welcome to stay. Like Brian said, we're always open to y'all doing more training as opposed to less. Today, we are going to go over the admin access, including registration, a dashboard overview, linking your case managers to recipients, and the different reporting functionalities we have available for you. We also want to talk about the case manager access, the dashboard view only overview, the messaging feature, and a use case review. The use case review is going to just occur throughout the demonstration, so there's not going to be a separate use case at the end. I know I had some questions about that last time. And I believe we are going to, I'm going to go ahead and stop sharing this presentation. And like I stated, we're going to start with the first initial question: how do you register? So as a case management agency, you're able to register, self-register by going to www.fortelus.com. And for those of you who don't know, right now you're hearing NetSmart and Mobile Caregiver Plus. The parent agency was TELUS, so eventually this fortelus.com website will transition. But for now, you're going to go to the fortelus.com website, find your state, and for the sake of this call, we're talking about Georgia DCH. This is actually a great landing page for information in general. If you want to come here and find some information for Georgia EVV, this gives you just the basic overview of Georgia, but you can go over to the registration tab here if you have not registered yet and click here. I do want to note before I get into how to register, if you have not registered yet, please ensure that you pick one specific registering admin. If you try and register, if you have two people in your office that try to register and one has already done it, your second admin will not be able to register and it could cause some confusion. So we do like to put out there, try and pick one admin to do the initial registration. Once you are registered, you'll be able to add additional admins to your profile, and I'll show you how to do that once we're in. But for self-registration on fortelus.com, again, you're going to go through the GDCH page, click on the registration tab here, and it's going to bring you to this main self-registration kind of info block. You're going to put in your tax ID and your Medicaid ID, as well as your zip code. I also want to note here, if your agency does multiple lines of business, let's say you have PSS and case management for some reason, please make sure that you're putting in the identifiers associated with your case management line of business. Otherwise, you won't be able to access the correct dashboard. If for some reason you put in an incorrect tax ID or Medicaid ID, it will bring you to a blank dashboard and you won't be able to use the function. So once you put in the appropriate information, you're going to prove that you are not a robot, in fact, and you'll click submit. And because this is a live page, we're not able to show you exactly what that looks like. But once you click submit, you'll have the opportunity to put in more information regarding your agency. That would be basic, you know, your address, the type of care you provide, and click submit. Once you've submitted that info page, you will get an email with welcome information. And that will tell you basically to go back to your ForTELUS page. And once you have your registration completed and your login information available to you, you'll click EVV login to access your dashboard. Let's see how far we can get here. Yeah, here we go. So EVV login, I have a demo account that we're actually going to be using, but it'll bring you to this page just like any other application you're using nowadays. You'll put in your username and your password and you'll click login. And at that point, you'll be able to view your dashboard. A couple of features that I want to point out here, just like, again, any other application that you are currently using, if for some reason you forget your username, you're able to click the forgot username link and follow the steps to reset it for you. Or if you forgot your password, same thing here. You click forgot password and it sends you an email to walk you through the steps to reset your password. Now, once you have logged in to the Mobile Caregiver Plus, you're going to be able to view your main dashboard. And I do want to caveat this by saying I am taking you into a demo environment. There's no HIPAA issues going on here. Some of the names you may see may be a little funny, but none of this is live data. This is for the sake of the demo. You're going to log in. And the first thing that you're going to see upon login is your main dashboard. This is a nice landing page for you to show up, and it gives you more or less a snapshot of what all is going on with your case management agency at this time. There's three main components to your dashboard. You have your navigation bar up top, you have your main menu to the left here, and you have your main window housing most of your snapshot information, as I call it. Up on your navigation bar, you can see that you have the option to minimize this menu if that's better for your screen size. You have your agency dropdown, your role dropdown, and your name dropdown. Now, these are interesting pieces to be able to use up here. If for some reason you have your agencies sectioned out into a couple different accounts, or if you're an administrator for a couple different case management agencies, all of the agencies that you are registered under will show under this dropdown. For the sake of this demo account, I have access to Case Management Agency 1 and Georgia testing environment. But let's say you could have, however many agencies that you are a part of, they will show here, and you can select which one you're trying to view at the time. You can also do the dropdown here for role. For this environment, I only have the role of Case Manager Agency, or I'm sorry, Case Manager Admin. But if you wear multiple hats within your agency and you are also a case manager, for example, you would choose this drop down to toggle between the different roles that you have access to. You can also drop down on your own personal name, and you can view your own profile and then log out. Over to the left, again, we have your menu bar here. You can choose between, dashboard, schedule visits, whatever you're in here to access. This is how you would get there. Nice quick little buttons here. But the main part of this dashboard that I wanted to make sure that we all saw was this snapshot of what you have going on. We built this dashboard so that you could have a nice high level overview of what's going on within your case management agency at the tips of your fingers and pretty quick access. If you notice, we have different tabs here with different colors and different titles. This is showing the various stages of visits that you have going on based on the time frame that you chose. So if you want to see what's going on exactly today, and again, this is a demo environment, so there may not be data in all the fields that we're looking today, but bear with me. But if you want to see what's going on today, you can get the number of visits that are currently in progress, that were unable to be completed today, missed, not started late, in progress late, visits that had been completed, as well as visits that had been completed late. Anything on the dashboard and throughout the tool that highlights, and the way if you could see on your screen that these tabs kind of highlight as you curse over them, that opens up more drill down information. So let's see if we can find, here we go. So we have one here. This is one missed visit. In the regular environment that you all have access to, you could click on this one missed visit and it will pull up the visit data for you to view. So instead of just seeing that, okay, I have one missed visit on, for last week, it'll tell you the caregiver, the member, and the date of service that missed visit occurred on. If you wanted to see the information for last week, same idea. It'll pull up last week's metrics here for you. And then 2 weeks ago, if you want to get a quick snapshot for payroll, if you're at the end of a 2-week period, that's a nice, quick, easy way to view that. Another way to view the same information is go down below. You have a nice bar chart here, and it puts it in a bit more of a visual status for you to see. On Monday, as you can see up here, we had some missed visits. So you see Monday, we have some missed visits. If we had completed visits in the system right now for you all to view, I don't think I have any in the demo. I don't. But let's say we did have some completed or the other statuses, those different color bars would be showing here as well. If it's helpful to what you're using this for, to put it in table format, you can do that here as well. And you can see by dates, the different statuses, and you can see your total. Use case here, if you want to see for the week of December 12th through the 18th, how many missed visits occurred within your recipient pool, that's a nice, easy way to view that total. The next thing I wanted to show you is the inbox feature. So as Brian had mentioned on one of the slides earlier, you are able to do secure messaging between the admin and the different case managers that are out in the field. This is where those messages would be housed. I'll show you how to send and receive those messages at a later point during the presentation. But if you have messages that are left unread, or if you have messages, here we go, that have already read in the past, you can toggle between the closed envelope and the open envelope, which I think is pretty standard for applications that you could be using now. If you look here, this is back from when I first went on, or back when I joined the team. Joe sent me a message. Hi, Lindsay, message me back when you get access. So that is how these messages will show for you here. And if you have a significant number of messages and you're thinking, oh, you know, I know that Joe had sent me a message a couple weeks ago about Mrs. Smith, let me try and search for the different messages. So you can search for any of these features here, the from, the to, any keywords here, and it will pull up that message for you, and it'll pull it to the top of this page. If you're on the dashboard and you would like to see if someone has sent you a message while you've been clicking around in here, you can use the refresh feature just like you could on most other applications. I know, Brittany, I know that we had determined that we're going to do questions at the end. So when I pause you guys, it's just me in the habit of saying any questions, but we're going to continue on and we'll hold most questions till the end. The next piece that I wanted to show you all was the schedule feature. This is a nice intuitive tool to be able to view all of your case managers or all of your members and what they have going on during a certain time frame. So if you notice, we have a couple different icons up here that we could choose from to kind of drill down the data that we're looking for and the different views that we have available. So this is a nice listed view of, let's see if we can pull some data in this environment for you. Or you know what, we'll go monthly. This is a listed view of the different visits that have occurred. And this is a calendar view of the different visits that have occurred just for yesterday, December 14th. But if we want to really drill down and see what's going on, again, in a bird's eye view with your case managers, you can select these different time frames over here to the right at the top. You can see what's going on today, what's happened throughout the full day, last week, or over the month. Another good feature, oh, I'll show you the schedule view too. So this is the schedule view. This is what it looks like. You have your user, which is your case manager, and you have your member detail in here. Just like I had noted before, any of these features in here can be clicked on to get more detail. I personally prefer the calendar view. I think that makes the most sense. And again, these are highlighting, so you're able to view the visit details by clicking. If you would like to view your calendar based on your membership, you can click member and it will reorganize them for you by member. If, let's say, you want to see all the visits that Divya had for the month, you can type Miss Divya's name. Divya. When it's not in the demo environment, you will be able to type Divya's name, and it will pull just the one member schedules out for you. So if you notice, we can see, yeah, more schedule details for previous months. Just gives you a nice, clean way of viewing this information. Okay. The next tab over on our menu bar here we have are the visits. And this is a bit more of the meat of what you as case managers are going to be looking at. When you first click on visits, it pulls the most recent visits that have occurred, all encompassing with all your members and all your case managers. However, it may be more useful for you to drill down to get some more finite detail. So if you see the top here, we have a couple different search criteria that we can utilize. You can narrow it down by payer. If you're serving more than one payer through the NetSmart tool, you can select which one you would like. Right now, we just have GDCH loaded. If you want to select just by member, you can click here and we can pick Rochelle. That will give us, once we click search visits, it will clean everything up and it will just give us Rochelle's visits, so on and so forth. So again, something to keep in mind, which is a little bit different on the verbiage that's used. We've got members, that's pretty universal, but user means case manager. If you work for, or if you have access to more than one provider agency, this is where you could select which agency you're pulling visits for. If you are aware of the visit ID that you're looking for, you could enter the visit ID in here. Let's talk use cases, visit status. If you want to see all of the in progress visits going on right now, you could narrow it down by only in progress visits. If you want to see all of the missed visits or the not started visits. So there's a myriad of ways you could use this tool to pull different information based on visit status. The visit to claim status, this means that the visit that the caregiver provided was pushed through for payment to DCH. So depending on the phase that that visit is in, it could be undetermined, it could be successfully claimed with DCH, or it could have received an error. And then also you could narrow it down by start and end date. So once you've determined what you want to look at here and you drill down the details that you're looking for, you could click search visits, and that will clean up the data down here. But for the sake of the demonstration, we're going to leave them all open. If you would like to view more information, you can, let's see, we're going to select what some people call it the hamburger, the 3 little dots here to the side, and that will open the visit data for you. But let's first talk information that you can view right from the starting screen. You can see the visit ID, the provider agency, the personal support aide who provided the care, your member, their procedure code, and then the scheduled start and end time. As you can see, all of these visits in the demo environment here have been missed. So we don't have clock in and clock out dates for these up here. We do down here, which we'll look at both the missed and completed in just a second. You can see your visit status detail, your payer, and visit to claim status. Again, because these are missed visits, it doesn't have all the information that a typical completed visit would, but we are going to look at both. Once you determine which visit you would like to look at, let's say you want to see this missed visit and see if maybe there was some detail put in for why it was a missed visit. You would click on the 3 dots here to open the visit detail. And this gives you a significant amount of detail into that visit. Even though it was a missed visit, there's still some detail that have been captured. The fact that it was missed, the aide that should have attended, the member that the visit was for, visit status. Obviously, none of these happened because it was a missed visit, but you are able to see completed tasks, which for Georgia would just be the service code that was provided or should have been provided. The scheduled start and end time, and then the scheduled address where this visit should have taken place. If it helps for what you're doing for your business purposes, this actually is printable as well. Now let's look at a completed visit. So Miss Brandy here actually did complete her visit for Mr. Racinos. This is a scheduled visit that should have occurred on the 18th from 9:30 to 10:30. It looks like it did occur on the 18th from 9:30 to 10:30. That's great. That's what we want to see. And you can open the visit detail to view a little bit more, drill down into more information. So we have a completed visit. You have your aide information, your member information. It was successfully claimed. So this visit was pushed through to DCH for payment by the agency. We have the service codes that occurred during that visit. We have the scheduled and actual start and end times available for you, the start and end verification time, as well as the address in which the visit occurred. And again, I'm going to keep pointing out this is a demo environment, so not all of the data is clean, but typically you would see a map with the address and the little pin drop for where that visit took place. If this were a real visit out in the field, we could have a signature here, or we could have, let's see, I think I missed it up here. Let's say the aide noticed something about the member that they wanted to share back with the case manager. They could put notes in here from their systems that you can view the notes. This is also a printable screen. So if you need to print it for whatever reason, if you want to keep anything on paper anymore nowadays, you are able to print it or save the PDF to your desktop, depending on what you're using it for. Okay. Another thing I want to point out, anything that we have, so we'll go through a couple different reports and reporting tools. If you hover over a piece of information, here we go, and you see an arrow show up, for example, that means that that is a sortable field and you can click on it. That will organize the data for you by date, either oldest to most recent or vice versa. So, the schedule you can organize, the, I think, yeah, the actual in and out, the visit. Nope, we can't do visit status. But yeah, that's just a tip and trick. So anything that you hover over with an arrow, that means that is a sortable field. So moving on to the prior authorizations tab. So this is an important thing for case managers to be able to see, so you can track what your members are receiving or what they're supposed to be receiving. If you need to alter their care, it's a nice place to start to view what that member should be receiving. The first thing you're going to do to view the authorizations is select the payer that you were looking for. So the payer would be Georgia DCH in this case. And just like with the visits information, all of these fields are search criteria that you can utilize to drill down information. So if you know that you want to find, again, Rochelle's prior authorization information, you can select that member. You can also see how many PAs do my case managers have based on procedure code, how many personal care, waiver service, home health, or what have you. If you know the authorization number that you're looking up, you can type the authorization number right in there. Member, again, let's see, procedure code modifier. If you have any modifiers, again, this is a demo environment, so we just don't have any available, but this is where the modifiers would show. And also the authorization status. If you want to see if there's any canceled, invalid, new, or updated auths in your auth pool, you could select it there. And then once you've drilled down to the details you're looking for, you're going to select search. And that will call up all of the prior authorizations that you have to view. Similar to the visit report, anything at the top here that has the arrows that show up, you can organize based on that function. So if you wanted, a lot of times it's helpful to do by date. If you want to see how many authorizations are, close to expiring by a certain date, this is a good place to look. Or the oldest auths that you have in the system, there's a couple different ways you could use that. See here, if you would like to view more information regarding this specific authorization, let's say for Mr. Rochelle, you click on the auth itself. You can actually click anywhere on this line, not just the Medicaid ID, but it pulls up the various information that is fed over to the tool by DCH. Again, the prior authorization and recipient information is fed automatically from DCH to the NetSmart tool, so you will not have to put this information in. But you can see the payer that's associated with that auth, the agency, if the program was taken in, the start and end date, auth number, procedure code, so on and so forth. So there's a lot of information that you can get just by unfurling the authorization line. The member ID, that's good to have. Let's see. Anything else major? The source system, that just means it came from Georgia, date created and last updated. So when you're done looking at this authorization, you simply just click anywhere on that line again. That will close it back up and you can look at another one. We're going to unfurl this one, same idea, same information. The modifiers are present. That's important to have. One thing that I do want to point out as far as authorization units. So we have total units authorized are 264. That's really important to know. Units used, units remaining. While we are still ramping up with EVV in Georgia, the source of truth for authorization units is still going to be DCH, still going to be GAMIS, just because if the claims didn't come through the NetSmart tool, the Mobile Caregiver Plus tool, the authorization units are not going to be correct. But we'd say probably, a couple more months into the program and those auth units should be a lot more source of truth than they are currently. We will bring that back in. And just like I had stated before, you can organize, you can pick by member, and you can use this for a couple different use cases. If you would like to print information, you can select the different authorizations that you are viewing. Let's say you want to print these, you would click print and it pulls it up in a PDF form. So you can print it or save it on PDF to your desktop if that helps with your business process. Okay, so the next tab that we're going to explore on the menu is members. This is a good way to view almost like a roster of the membership that your case managers are serving. And very similar to the last two tabs, you have your search criteria listed here at the top first. If you know the member that you're looking for specifically, you can search that way. If you know the Medicaid ID, the social is not fully taken in the state of Georgia, but if you know the last four, that's a searchable tool as well. If you know their date of birth, member ID again, or if they're active or inactive. Once you've drilled down to the detail that you're looking for, you would click search, and it would show the member that you were looking for or members that you're looking for. So there's a couple different functions that you have from the member, for the member themselves. If you want to look into more of their information, you're going to open using the three dots here, or the hamburger if some people refer to it. You open the details. The first tab under each member is just their general information, first and last name, Medicaid ID, so on and so forth. The address, this is an important one for EVV. This is going to be their primary address where their care should start and end unless they have a reason to be out in the field. Payer subscriptions, this just tells you where they're in, who they're contracted with. Any notes, so there's a couple different reasons why the note could be in here. The caregiver could put a note through the system, or the case manager could be alerting the case management admin via note, but this is where all of the notes for this particular member would stay. Documents, we don't actually do that in Georgia, or at least there's no reason to at this time. Referring physician could be entered there, but most importantly for the member detail, we're going to look at linked users. This is the page that determines which case managers will have access to view the member's information. And as you can see, there's a number of case managers that have been linked to this, fake patient, Mr. Lopez here, at this time. We keep everyone here so you can see historically who has had access, who currently has access, and you can manage the accesses to this member from this page. For example, we have C. Bouvier is here. She does not have access. She is not currently linked to this member. But let's say, she's not linked right now, but you want to put this member on her client load. You would open the three dots here and link user. Do you really want to link this user to the recipient? Yes, I do. Click OK, and you can see in this little green box here, user is successfully linked. So now C. Bouvier is able to see, view only, of course, the visit information for Mr. Lopez's visit data. Let's say C. Bouvier is like, okay, they took care of this member for a few weeks. Now we want to remove that member from their load. You would do the exact same process. You would click on the three dots here, unlink user. Do you really want to unlink the user? Yes, I do. Click OK, and you can tell by this box here, user was successfully unlinked. Now at this time, C. Bouvier can no longer see the visit details or any of the member details for that member. So we have 1, 2, 3, 4, 5, 6 case managers that have been or are linked to this member, but we need to add another one. If you already have all of your case managers loaded into your dashboard, then this is an easy process. If not, we're going to get to how you add your case managers in just a second. But you would just click the plus sign down here. You guys can see that. Hopefully it's not too small. And you would expand this page. And this gives you your entire roster of case managers available to see this member. You could search using the full name for the user. And again, user means case manager. Or you can just scroll down, depending on how many case managers you have. I know some agencies have hundreds, some have 10. So depending on how you're using it, you could search, you could scroll, or you could page over, depending on how many you have. Once you've determined which one you would like to have linked, we'll pick Ms. Gregoria here to link. We just click link. User is successfully linked. Great. So then when we come back to this screen, you can see Ms. Gregoria was just added as one of the case managers that has access to this member. It's pretty simple to link and unlink once you have your case managers loaded. Now, the next tab is probably one of the most important tabs to this group here. This is how you would add your case managers to your account. So first thing you see when you click on users, you see and the avatar doesn't matter that much. If your case managers want to change it, they're more than welcome to, but it's there. You have their username, their first name, last name, phone number, email, their role, and their invite status. So there's a little bit to unpack here. Every case manager does have to have an email, and that email is going to be the main identifier for that case manager. It's going to be used for a few different things, so it's important that you have an accurate email. The role is going to give the case manager whatever access you want them to have. Case manager admin is able to do everything that I'm showing you today. If they are a case manager and they don't have admin rights, that is what the case manager role looks like. And I think that's it. Oh, provider admin. You guys won't have any of those as case managers, so ignore that. This is a demo environment. The other column here, invite status, accepted or invited. We have some case management agencies that have called into the call center lately saying, I've invited my case manager. They say they can't see anything. What's going on? Your first step to troubleshoot this is going to be going to your users tab and seeing if your case manager, the one who's saying they can't see anything, have they accepted their invitation? Now, what does that mean? We will get there in just a second. So that's a nice snapshot of your user page here. You can open more detail about each user, each case manager by clicking on the 3 dots. You can send a message to that user. If you guys remember on the main dashboard, there's a messaging feature. If that case manager needs their password reset, you can assist them through this button here. You can unlink them from your agency by clicking unlink user. You can pull up more details about your case manager by clicking on details, and you can also edit their role. So let's say you have I don't know if I have any examples here in the demo environment. Let's say you have a case manager. Here we go, Celine. Celine she only has case manager, a case manager role listed on right now, but you would like to give her admin access. You would simply click edit user roles, do your drop down and add case manager admin. If you want to remove her as a case manager, I'm not going to do that because I don't know what she's doing in the demo environment with it. So, but you would just click whichever role you want her to have and you would click save. And that will update her rights and her view only rights and her reporting rights. And now if you look, Celine now has case manager admin as well as case manager as her role. So that is all good and well for your case managers that you've already added, but how do you add a new case manager? You have someone who's just recently started and you need to add them to your roster. You're going to click on this plus button here, up here, top right-hand corner. Hopefully you guys can see that, and it will open up this screen. The first thing it's going to do is have you search using that email address. Now, if you remember, I did say that email address is going to be the main identifier for your case manager. So make sure that that is the correct email address that you're entering in. I would like to see if we'll go with, I'm going to put my own email address in here, if I can be added. So I'm going to put my email address in here, and the first thing that pops up, it will show you in this box that I already have an account with Mobile Caregiver Plus. And that makes it pretty easy. At that point, if this is the case manager that you're trying to load, you would just click here, click here, click here, and you would add that case manager to your load. However, most likely, if you're adding a new case manager, they do not already have an account. So I'm going to kind of make this up. You put in their email address, search, no user can be found. So you confirm that that is the email address that you want, and then you'll come down here and you will add the necessary information. Very similar to any other application that you are using right now. If there is an asterisk next to the field, that is a required field to move on. So you're going to need a first and a last name, their username, and let me see, there's a personal support aid type. For case manager, you're just going to leave that at other. Let's go ahead down a role. This is where you would assign whether it's a case manager admin or just a case manager. You could click or both, or you could unclick, whichever one you want to add them as. You'd select the role there, so on and so forth. You can add depending on how you're going to be using this portal for your case manager management, if you have an internal employee ID, this is where you would put that. If employee effective start and end date, if that's important to you, you can put that in there. But anything without an asterisk is not required. Once you've filled in as much information as you would like and required, you would click Invite New User. Once you click Invite New User, that new case manager is going to receive a welcome email to this email address, which is again why it's so important to make sure you have the correct email address. That welcome email is going to give them steps on how to access the tool. And from there, it's kind of similar to how you would register it as a case manager admin, but there will be a link and there will be a self-registration tool to do from there. Please, please, please do not tell your case managers to go on and register the same way that you did as a case manager admin, because it will not work. This is the only way for a case manager to join, is to be invited in and invite new user. Once you've completed that informational sheet that we just saw there, that case manager's information will show on your roster, and we'll pick on Celine again here. Celine has been invited, but she has not accepted via the email that she received when she was invited. So I'm going to do another brief walkthrough because this part's pretty important. This is your user roster. If you're adding a new case manager, which when you first register your agency, you will have to do this piece, click the plus button. Oh, it timed me out. Sorry. Give me 1 second. There we go. You're going to click the plus button here, search for their email address. Most of your case managers will not already have accounts unless they're working for multiple agencies, and fill out the basic information. Anything with an asterisk is required. Role is very important. Are they a case manager or should they have admin rights? You can decide one or both. And then when you're done, click Invite User. Your case managers will receive that welcome email with detailed instructions on how to proceed as a case manager. Okay. Let's see, anything else from here? Just like anywhere else, I mean, you guys should be pretty familiar. This is the refresh button. If you're sitting here really hoping that Celine has accepted and you don't know if she has yet and you want to click refresh, you can do so and it will update all of your statuses if anything has changed. Okay, so the next tab that we're going to look at is the Reports tab. There's some basic reporting functionality that's available to case management agencies at this time, and we are looking to build these out as we progress through this program and determine what works, what doesn't work, what you guys really want to see. We are definitely open to feedback to make this tool as useful for you all as possible. The first report you're able to see is a recipient list, very similar to your member list, but it's in a different format. You have your searching tools over here to the left. If you know your member's first and or last name, you can search that way. Select. Note here under selected, we picked 3 members. That's where they are. If you're like, oh, you know what? I don't really want to look at Birdie's information. You can deselect, or from your main screen here, you can deselect by clicking on it again. But, you know, click on whichever members you're looking for more information on, or if it would be helpful to you for any reason, you could differentiate between male and females on your roster. Click apply once you've determined your search criteria, and it will pull up this information over here to the right. Interesting, I guess you could say it's interesting. An interesting feature that we have here in this reports tool is you're able to export this information. So depending on how your process is for your business, if it's more helpful to you to have this information in an Excel format, you can export here into a PDF. You could do Excel or the SLSX feature, and that will bring it out to your basic Excel sheet, and you can use that to compare to your current system or whatever you would like to use it for. Okay, so the next report that we will look at would be visit detail. And again, this is very similar information to what we had already seen on your dashboard and the visit tab. It's just in a different way. So it depends on what you're using it for, which type of report you will pull. So we'll go back to November. I feel like this is a pretty intuitive piece. You know, your start and end date, you're going to look for visits between, I chose November 1st and December 1st. You can narrow it down by caregiver, which is in the other areas of the tool called a user or your case manager. Or no, actually, I'm sorry, I misspoke. Your caregiver is your actual support aide. Or you can narrow it down by recipient and click apply. And that will pull up, depending on, I don't know if it will pull up here in the demo environment, but it will pull up a very similar visit report to what we've seen in the visits tab, but it would be in an exportable format. So just like the other report we had, you can pull it out to PDF, you can pull it out to an Excel or an SLSX format, and you can use that for however you would like. The last report that we have is the visit. Okay, so that was visit detail. That gives you more information drilled down into the visit. The visit report is a little bit more at face value. But yeah, here we go. You can choose your start and end date, just like the last report. You can pick your specific recipient or caregiver or the status of the visit, and you would click apply. And just like the other visit reports, you can get the basic information regarding that visit. And since this is in the reports feature, you can export it out to Excel, PDF, or SLSX, depending on what you would like to use it for. I think we hit we did. That's all the reports right now. And like I had said, we are building these out hopefully soon. So if you have any feedback or want anything else in the reports feature, feel free to share that with me, or sorry, Brian, with Brian, and we can see what we can do for you, because we want this tool to be useful for you all in your agencies. The next part of the menu is just your provider agency information. This is just your basic information for your case management agency. You have your name, short name, address, basic information. When you do initially register, I will put this out there, when you do register, go to your provider agency tab and make sure that all of this information is correct. And if it is not, that is something you'll have to contact the state about. But it helps in the long run if all of your information is corrected here. We have your payer information. Right now, because this is a demo account, we only have access to payer GDCH. Eventually, if you start working with the CMOs in Georgia, or whomever else you're working for, all the payers that you're contracted with will show here. And other contractor information. I don't think this is something that we're using in Georgia quite yet, but it is here, so we can build it out eventually. The last major part that I wanted to touch on with you all today was this training tab. If you end up with a question and you are in the tool and you can't quite figure it out, before you pick up the phone and call the call center or email Brian or me or whomever, check out this training tab. You're going to click on training. You have this link here, go to training. That automatically kicks you over to that Fortellis website that we had started on, almost an hour ago now. And you can view the different training resources that we already have available to you. So there are user guides, video tutorials, different FAQ documents will be coming soon, which is very helpful, I know. We have recorded webinars. So this webinar, for example, may go right here under recorded webinars. Training webinars, if we have any training webinars coming up in the future, you could find information about those here. And then we also have a link to the support desk directly at NetSmart. However, because you guys are in Georgia, we are using the Conduit call center. That information for that support system will be shared when I'm done doing the demo. But if you have a question about the portal and you know that you've seen it somewhere, you've reviewed the user guide, this is where you can very quickly self-help, pull up the user guide, pull up a video tutorial, and kind of guide yourself through it. The video tutorials are fantastic. There aren't any for case management right now, but I know that there will be. And the user guides are really user-friendly and helpful as well. But I think, let me review my notes here. I think I may be at the end. Let's see. Brian, did you want to open for questions at this point?
Yeah, I think that's a good idea. We have quite a few questions, and some general panic in the chat, which is unusual. So let me start by saying that the EVV system, as it relates to case management or support coordination, and it absolutely positively 100% does include support coordination, which is a case management function for the now and comp waivers, is a tool in your toolbox. It's something that we're providing to you so that you will have a look in for community living support services and personal support services. It is not taking the place of an authorization system like Alliant or Beacon. It is simply another tool in your toolbox that enables you to look at, what's going on with your members, because I know as a case manager, you're concerned about the health and welfare and that of your members, and that proper services are being delivered, and that they are, not being serviced by a provider that consistently misses visits, or is consistently late, or is not adhering to the schedule that you guys have worked out with the member. Another couple of set of questions I've seen in the chat in a general message is, services are supposed to be flexible. They absolutely positively are supposed to be flexible. And we understand that not everybody will stick exactly to a schedule, but a schedule of unmet need is 100% a requirement of a 1915C waiver that must be adhered to, or it is in violation of the waiver program. So we broker hours based on unmet need. That's what we do in a waiver. That's a 1915C principle from the start of 1915C principles. So there should be a schedule that you are able to see, and this variance is to that schedule. Of course, that you may have a variance to that schedule. Somebody may have to stay late. Somebody may not need somebody for that day. Totally understand that. But there should also be a basic schedule for folks to follow. Some other points I want to get on this, because I do see some more basic panic here. If you have not been to our website, please, please, please go to the EVV website. All of our communications have been documented and fully transparent back to November of last year. That includes all town hall meetings, which have been twice a month since November of last year, and all presentations. There are frequently asked questions for providers and members. There are toolkits for providers and members. There are checklists for providers and members. There are Q&As for providers and members that answer a whole bunch of the questions that I'm seeing here on the chat, and a whole bunch of the concerns that I'm seeing on the chat. And you will be able to review this presentation and the previous presentation so you can go through. There's also links in the presentation to all those trainings that Lindsay was noting. There are very short tutorials on virtually every topic in EVV, from resetting your password to claims processing. Of course, as a case manager or a support coordination agency, you're not going to be using EVV to do your billing and your claims processing. Again, this is just a toolbox for you to use in order to be a better case manager and to get a better insight into what is going on in your members' lives. That's why we have it built. Okay, let me see. I know we only have 7 minutes left, but let me see if we can't go through a couple of specific questions that I haven't already answered. I answered the first one. That's good. So, I can't believe I didn't say this. So, yeah, the second question is really good. It's about, hey, I'm not able to register at all of our sites. When I attempted to register a second site, I get an error message. If you have those issues, you do need to call the GA call center, and we can post that here for you, what those call center numbers are, or we can put it, it is available on our website, or Lindsay, who is very, very quick, can put it up on screen so you guys have it at the same time. Thank you, Lindsay. And it's pretty important to, if you have your kind of information, your agency's name, your ID, that kind of information, the registration is very specific to location and what your zip code is. So make sure you know what that zip code is, because what we saw when we were registering PSS and CLS providers were that a lot of providers didn't have the correct matchup for their zip codes versus what their IDs were. You do register your agency, and then Lindsay kind of walked through how you add your members. So yeah, that is the function here to be able to register. As far as a question of, to be perfectly clear about who puts in the hours or schedules and the missed visits, that is a function of the community living support provider or the personal support provider. So they have already done that work, y'all. They are way ahead of you on this. They have put in all their members and their schedules, and they have their aides clocking in and clocking out. We have one provider that is billing $1 million a month through the EVV system, all with correct clocking in and clocking out. So they're out there utilizing the EVV system. So I've gotten a rather pointed message that says support coordinations are not required to manage or monitor, enter, or report information into the system. So I want to again tell you, this is a tool in your toolbox to be a good provider and a quality provider. We would expect that you use all of your tools that are available in your toolbox. As far as requirements, we have not at this point modified any policy manuals to make anything a requirement that support coordinators use. That may be something we do in the future, but as of right now, we are not in that space. So you are absolutely right. And to be perfectly clear, support coordinators are not required to manage, monitor, enter, or report any information at this time. At this time, you are not. And of course, we would put that in the policy manual if it were to be a provider, a requirement, and clearly report that in the policy manuals. So this doesn't take, and again, this is another question that came into chat. It doesn't take the place of any documentation that you guys do at this point. We would outline what that would be if we made it a requirement in the future. Okay, sorry, got some messages there at the bottom, so I just want to make sure that I'm able to answer as much as I can in the next three minutes. I think I answered that. Again, I want to let you guys know that for your agency, for case management or support coordination, you would be adding in your members for your agency, but you're not adding in the CLS hours and the agency who provides CLS or PSS. You're not adding in their hours. Those agencies are responsible for doing that work themselves. And quite honestly, they've already done the work. So you don't have to go in and done that. They've already done all of that work. So there's a lot of more general questions that are honestly what I will take all these questions back and we'll do a Q&A and respond to them. A lot of them are just basic support coordination questions or case management questions. They're not really EVV questions. They seem to be more about what are your requirements to do case management. So we'll make sure that we take all the rest of these questions back and we address each one of them in the form of a frequently asked question, or if we know what your agency is, we do respond to those questions directly. If you don't want to wait for that, you can utilize, if you have specific questions about registration, please go to the EVV mailbox. If you want a direct response from the Department of Community Health to your question, you can utilize the EVV mailbox. I don't know if that is in one of the slides, but it is on our website and it is on all of our presentations. So if you go to our website, you will see what the EVV mailbox address is, or there it is right there. Thank you, Brittany. evv.medicaid@dch.ga.gov. and we'll be happy to respond to you one-on-one. I know a lot of times providers like an individualized written response so they can keep, and we're more than happy to do that if you have questions, concerns, or comments. So we're right at 5 o'clock. I want to thank you for all of your time. I want to remind you and your input. I want to remind you that this information is available online and will continue to be online. We will have additional town halls in January that are not specific to support coordination, but as a reminder, we do have town halls that will continue. I hope you all have a wonderful Wednesday and you have a wonderful rest of your week. Thank you and have a good day.